Skeletal muscles contract in response to nerve stimulation to allow you to move. When you want to stand up from a sitting position, the motor area of your brain triggers the nerves that specifically control the muscles of your legs so that only those muscles contract to enable you to straighten the legs enough to lift up to a standing position. If for some reason the nerves connecting to your brain to your leg muscles are not working, the muscles will not contract and no movement will occur. A skeletal muscle spasm is an unwanted overcontraction of one or more muscles. This often occurs when the nerves controlling contraction of a muscle sends an inappropriate signal to that muscle. Common causes of inappropriate nerve signals include pressure on the nerve, swelling along the nerve path, and low blood calcium levels. Spasms also occur when a muscle is irritated or damaged. Pain from a spasm is a large muscle and it can be intense. A Charlie horse is a calf is an example of a painful muscle spasm. Inflammation is a response to injury or infection caused by white blood cells, also known as leukocytes, and their products that results in reactions of tissues and blood vessels. These reactions cause the 5 major symptoms of inflammation, known as pain, redness, warmth, swelling, and loss of function. For example, a person with a severely sprained ankle can have redness, warmth, and pain. Swelling can prevent walking well on the ankle, which causes loss of function. Although inflammation can be uncomfortable, it is a normal reaction of the body to tissue injury and is generally a protective type of reaction. However, when inflammation occurs over a long period or occurs without tissue injury or invasive by bacteria and other organisms, the result is an overreaction that can damage or destroy surrounding tissue. There are 2 forms of the COX enzyme, COX-1 and COX-2. COX-1 is present in all cells and makes PGs, prostaglandins, that are helpful and protective. You can think of COX-1 as good COX. For example, COX-1 in the cells of the stomach lining makes prostaglandins that produces thick mucus. The mucus protects the stomach lining from being harmed by the gastric acids needed for the food digestion. COX-2 is present mainly in areas of inflammation. COX-2 is responsible for the types of prostaglandins and other mediators that start and continue the inflammation process. You can think of COX-2 as bad COX. This distinction will be important as you consider some of the expected side effects and adverse reactions caused by anti-inflammatory drugs. Although inflammation responses are uncomfortable, they have helped injured tissues to regain function. White blood cells release growth factors that 1. Trigger repair of damaged tissues and cells. 2. Stimulate healthy cells in the injured area to divide and replace dead or damaged cells. 3. Promote scar tissue formation in tissues that can no longer divide. Remember that scar tissue does not act or function like normal cells. Although inflammation is mostly a protective process that helps prevent infection and promote healing, it can cause serious and sometimes painful damage if it goes on for too long and occurs when it is not needed. For example, some people develop autoimmune diseases in which the immune system fails to recognize normal body cells and attacks some tissues continually. One such disease is rheumatoid arthritis, the chronic inflammation in the joints with excessive and continual release of mediators, especially TNF, causes destruction of joint cartilage and other normal joint tissues, resulting in severe pain and greatly reduced joint function. Over time, the person can lose all function in one or more joints and have very limited mobility along with chronic pain. Inflammation management. Many acute problems that cause inflammation, such as sprains, fractures, or tears, require short-term therapy with anti-inflammatory drugs. An anti-inflammatory drug has as its primary purpose to reduce pain and prevent or limit the tissue and blood vessel responses to injury or invasion. Many chronic inflammatory disorders, such as arthritis, can require long-term therapy with anti-inflammatory drugs. Long-term therapy is prescribed to reduce the symptoms of inflammation and prevent tissue-damaging complications. It is important to recognize that most of the drugs used to treat short-term or long-term inflammation can have serious adverse reactions. The patient's response to therapy must be monitored closely. A variety of drug categories are useful in managing acute and chronic inflammatory conditions. Non-steroidal anti-inflammatory drugs, also known as NSAIDs, corticosteroids, disease-modifying anti-rheumatic drugs known as DMARDs, and anti-gout drugs. As described previous in chapters, one of the symptoms of anti-inflammation is pain. When inflammation is managed, pain is also relieved to some degree, which is why anti-inflammatory drugs are prescribed for pain management. For inflammation caused by gout, management also includes drugs that reduce the production of uric acid, which forms crystals that deposit into joints and cause gout. Although many NSAIDs are available over the counter, they are still potentially dangerous, and great care should be taken to avoid overdose. Larger doses must be obtained from a healthcare provider and monitored very carefully. Non-selective NSAIDs, particularly aspirin, inhibit platelet aggregation, which is also known as clumping. This effect is very helpful when these drugs are used in low doses to prevent clotting in patients with coronary heart disease. However, the effect on platelets can also lead to increased risk of bleeding, particularly when NSAIDs are given at higher doses. For NSAIDs other than aspirin, platelet inhibition is dose-related and reversible. Patients who take aspirin must be monitored for bleeding due to irreversible platelet inhibition for the lifespan of the platelets, which is about 7 to 8 days. This is very important if a patient is scheduled for an invasive dental or surgical procedure. The healthcare provider must be made aware of the situation so that the aspirin can be discontinued 1 week prior to the procedure. A COX-1 inhibitor, its action is to decrease the activity of cyclooxygenase 1, also known as COX-1, and cyclooxygenase 2, which is known as COX-2, to reduce the formation of inflammatory mediators from arachidonic acid. The examples of these drugs are aspirin, Bayer, ibuprofen, Advil, and naproxen, Aleve. The nursing implications about COX-1 and COX-2 inhibitors. These drugs have more side effects at lower doses than selective COX-2 inhibitors. The patients need to be informed that these drugs all increase the risk of bleeding because they interfere with the platelet function of the clotting process. The patients need to understand to stop taking aspirin 1 week before a dental or surgical procedure and any other COX-1 or COX-2 inhibitors at least 2 to 4 days before any other procedure because of their increased risk for bleeding. The patients need to understand to report any stomach or abdominal pain or discomfort or any sign of blood in the stool to their healthcare provider because these drugs also increase the risk for GI ulcer formation. Make sure that the patients understand not to take NSAIDs while they're taking any type of warfarin because of the risk of bleeding is so severe that hemorrhagic stroke is likely to occur. Some further nursing implications is to teach the patient taking NSAIDs, accept aspirin, to weigh themselves at least twice weekly and keep a record because these drugs can increase the salt and water retention, which can worsen heart failure and raise blood pressure. Instruct the patients to take NSAIDs with food to help prevent stomach irritation. Instruct the patients to drink 2 to 3 liters of fluid daily while they're taking the NSAIDs to ensure good blood flow to the kidneys because all of these drugs except aspirin can cause kidney damage. Instruct patients who have diabetes to check their blood sugar levels more often because these drugs increase risk of hypoglycemia, which is low blood sugar, and patients who take oral anti-diabetic drugs. Patients that are prescribed NSAIDs on a regular schedule because of inflammation is better relieved when there is a stable blood level of the drug, so it is better for the patient to take this drug on a very routine basis throughout the entire day, which means a 24-hour period. COX-2 inhibitors have an action that are selective and mostly inhibit the COX-2 pathway for arachidonic acid production of inflammatory mediators. Some examples of these drugs are celecoxib, known as Celebrex, meloxicam, known as Mobic, and diclofenac, known as Voltaren. NSAIDs are typically the first drugs used to treat a variety of inflammation-based problems that are often associated with pain and fever. Pain in the muscles, nerves, and joints, neuralgias, arthralgias, respectively. Headache and dysmenorrhea are commonly treated with NSAIDs. Various forms of arthritis, such as rheumatoid arthritis, osteoarthritis, psoriatic arthritis, may be responsive to NSAIDs as well for pain and other symptoms of inflammation. NSAIDs are also used short-term for the management of pain related to a dental extraction, minor surgery, or an athletic soft tissue injury. A nursing implication would be before the first dose of a celecoxib, ask whether the patient has an allergy to a sulfa-based antibiotic because a patient who is allergic to sulfa is likely to also be allergic to celecoxib. It contains a chemical that is similar to sulfa, and there is a higher incidence of patients being allergic to sulfa drugs than most other drugs. Tell patients they do not have to stop these drugs before a dental or surgical procedure because COX-2 inhibitors do not interfere with platelet and blood clotting. Patients who take COX-2 inhibitors exactly as prescribed, higher doses will result in the same side effects and adverse reactions as the COX-1, COX-2 inhibitors. Avoid giving these drugs to anyone who has angina, who smokes, or who has severe coronary artery disease because of the risk of heart attacks. Although many NSAIDs are available over the counter, there are still potentially dangerous drugs, and great care should be taken to avoid overdose. Larger doses must be obtained from a healthcare provider and monitored very carefully. Non-selective NSAIDs, particularly aspirin, inhibit platelet aggregation. This effect is very helpful when these drugs are used in low doses to prevent clotting in patients with coronary heart disease. However, the effect on platelets can also lead to an increased risk of bleeding, particularly when NSAIDs are given at higher doses. For NSAIDs other than aspirin, platelet inhibition is dose-related and reversible. Platelets who take aspirin must be monitored. Patients who take aspirin must be monitored for bleeding due to irreversible platelet inhibition for the lifespan of the platelet, which is about 7 to 8 days. This is very important if a patient is scheduled for an invasive dental or surgical procedure. The healthcare provider must be made aware of the situation so that the aspirin can be discontinued 1 week prior to the procedure. NSAIDs increase the risk of serious cardiovascular events, including myocardial infarction and stroke, which can be fatal. Cardiovascular events can occur early in treatment, and their incidence may increase the length of NSAID use. NSAIDs increase the risk of serious gastrointestinal adverse events, including bleeding, ulceration, and perforation of the stomach, which can be fatal. Elderly patients and patients with a prior history of peptic ulcer disease and/or GI bleeding are at greater risk for serious GI events. Common side effects of non-selective NSAIDs are heartburn, nausea, vomiting, dizziness, headache, and increased risk of bleeding and bruising. The GI effects may be minimized or avoided if the drug is taken with at least a full glass of water. If the medication does cause mild GI upset, the patient may take the medication with a small amount of food or milk. All NSAIDs except aspirin can cause some degree of fluid retention, edema formation, and increased blood pressure. This is particularly important to note because NSAIDs should be avoided in patients who have high blood pressure, heart failure, or renal failure. Selective NSAIDs have fewer GI effects because they do not impact the protective effects associated with the COX-1 enzyme. The adverse reactions, although expected side effects, are often bothersome to the patient. They typically can be managed, and the patient can continue taking the medication. The adverse reactions, however, must be recognized and reported to the healthcare provider immediately, and the drug will most likely be discontinued. Several adverse reactions may occur in patients taking NSAIDs, including allergy, ranging from mild symptoms of rash and shortness of breath to anaphylaxis, renal failure, upper or lower GI bleeding, and blood disorders. Patients taking COX-2 inhibitors may have an increased risk of myocardial infarction and stroke, and it is important to recognize symptoms associated with those disorders. Patients who are allergic to one non-aspirin NSAID may also be allergic to another due to cross-sensitivity. This is generally rare, but it is important to note all allergies in the medical record and report them to the healthcare provider before giving the drug. Aspirin has been associated with the occurrence of Reye syndrome when given to children with a viral infection such as varicella, known as chickenpox, or influenza. In Reye syndrome, symptoms may affect all organs of the body, but most seriously affected are the brain and liver. It can lead to permanent brain damage and death. Therefore, the use of aspirin is avoided in children, especially those who have an acute illness. Too much aspirin can lead to toxicity and can be life-threatening. Symptoms of aspirin toxicity may progress from mild to severe, beginning with tinnitus, ringing in the ears, hyperventilation, diaphoresis, thirst, headache, drowsiness, skin eruptions, and electrolyte imbalance. Symptoms can progress to central nervous system, CNS depression, stupor, convulsions, and coma. Tachycardia and respiratory insufficiency. If patients exhibit any of these symptoms, it is important to notify the healthcare provider early. In the lifespan considerations of an older adult, taking NSAIDs have a higher incidence of excessive bleeding and perforated ulcer compared with younger adults. Older adult patients who have some degree of renal impairment are at higher risk for damage to the liver and kidneys caused by NSAIDs. These drugs should be avoided in older adults. If prescribed, they should be administered with a proton pump inhibitor such as omeprazole, known as Prilosec, to reduce the risk of GI effects. Drug interactions such as alcohol taken with any of these NSAIDs increases the risk of GI bleeding. The effects of anticoagulants, sulfonylureas, and sulfonamides are increased if they are used at the same time as aspirin. NSAIDs interact with each other, which increases the risk of side effects, adverse reactions, and toxicities. Patients should not be taking more than one type of NSAID at any one time. Different NSAIDs interact differently with other drugs, and interactions are common. Consult a pharmacist or your drug handbook for a complete discussion of the interactions associated with a particular NSAID. These are examples of common interactions. Aspirin and other NSAIDs should not be given to treat vaccination-associated fever and pain because they can prevent the normal immune response and its protection. NSAIDs, except for aspirin, decrease the effectiveness of many antihypertensive drugs, especially angiotensin-converting enzyme inhibitors, known as ACE, angiotensin II receptor blockers, known as ARBs, beta blockers, and most diuretics. All NSAIDs increase the risk of bleeding for patients who take any type of anticoagulant. All NSAIDs increase the risk of hypoglycemia, which is low blood sugar, in patients with diabetes who take an oral anti-diabetic drug. The nursing implications in patient teaching. Ask patients whether they are using any over-the-counter or prescribed NSAIDs because patients sometimes do not report or may forget occasional use of aspirin or other over-the-counter NSAIDs. Many forms of NSAIDs are available over the counter, and it is important to assess whether the patients are taking more than one kind. Check for a history of allergy to aspirin or other NSAIDs, asthma, blood disorders, and GI problems or ulcer disease, or other liver or kidney problems. These conditions are precautions for or contraindications to the use of NSAIDs and should be reported to the healthcare provider before giving the drug. Assess which other prescribed and over-the-counter drugs the patient takes daily because NSAIDs interact with many other drugs. Check with the pharmacist to determine whether or how the NSAIDs is expected to interact with the patient's other drugs. When planning and implementing, the dosages of different NSAIDs vary widely. Ensure that you give the dose that is within the correct dosage range for the specific NSAID. There are many forms of NSAIDs, including tablets, capsules, eye drops, chewable preparations, suppositories, and injectables. Several NSAIDs may be applied topically. The healthcare provider considers the best form for the patient's individual needs. Give the NSAID with a full glass of water to reduce the risk of GI disturbances. If the patient has a stomach upset, try giving the drug with food or milk to reduce the symptoms. If the patient continues to have GI upset, notify the healthcare provider. If the drug is given in suspension form, shake the container well so that the dosage is accurate. The patient should be well hydrated before taking the drug to reduce the risk of kidney damage. In the evaluation part, monitor the patient to be sure that the symptoms are resolved. The pain level decreased, the temperature reduced. Pain typically decreases after administration of the drug. Reduction of inflammation may take as much as 1 to 2 weeks in some cases. The dosage should be reduced for the drug stopped if tinnitus, ringing in the ears, develops. Observe for symptoms such as pain or fever that do not respond to the drug, which suggests that the patient is getting worse, and notify the healthcare provider. The patient may need a larger dose or more potent drug or alternative therapy. Assess the patient for signs of increased bleeding, especially of the gums and mucous membranes. Check the skin for large bruises or bruises that flow together. Assess for petechiae, pinpoint purple or reddish spots on the torso or extremities. Examine stool, urine, and vomitus for blood. When blood counts are performed, assess whether the numbers of red blood cells and platelets are normal or low. Report low counts to the healthcare provider immediately. The patient and family teaching. These drugs may cause stomach upset, and NSAIDs should be taken with a full glass of water and/or food. Contacting the healthcare provider right away if ringing in the ears or abnormal bleeding or bruising. Bloody or black tarry stools are noted. Report to the emergency room immediately if the patient experiences chest pain, shortness of breath, or other signs of potential heart attack. For some chronic problems, you may need to take your prescribed NSAID for longer than 1 to 2 weeks before noticing a decrease in symptoms. Drinking at least 8 to 10 glasses of water per day to stay well hydrated while taking NSAIDs. And for best effect to reduce inflammation, taking the prescribed NSAID on a regular scheduled basis to keep a stable blood level of the drug, and do not take more than the prescribed dose. Instruct the patient not to consume any over-the-counter medications or drugs that contain aspirin or any other NSAIDs while they are taking this prescribed NSAID. If they have a fever that does not go away within 24 to 48 hours, they need to consult their healthcare provider. To keep aspirin and other NSAIDs out of the reach of children because of the wrong dose may be toxic to a child. And if they're unable to take the drug in the form that is prescribed because of difficulty swallowing, they need to contact their healthcare provider so that another form of the drug can be prescribed to them.